Hi, my name is Kirsty Baxter. I'm a nutritional therapy practitioner of over 6 years, and I'll be sharing my research with you.
Exploring the lived experience of personal growth in individuals who have experienced weight loss, an interpretive phenomenological analysis study. Today I'll be presenting my research from my master's, which looked at obesity weight loss. The reason behind my study was the fact that I am a nutritional therapist where weight loss is the epicenter of my practice. I'm looking to enhance the nutritional therapy approach to weight loss. And to do this, I have looked at the psychology behind weight loss. Obesity weight loss is the focus of this study, where obesity is the dominant medical term in the United Kingdom to describe individuals with a body mass index of 30 kilograms per square meter or greater. This research also emanated out of the fact that the COVID-19 pandemic heightened the awareness around obesity, where at the time in 2021, England had an overweight problem of 63% of adults being overweight, where the BMI of overweight individuals is 25 kilograms per square meter or greater. The aims of the research were to explore the lived experience of personal growth as a consequence of losing weight, and in so doing, understand the psychological aspects of weight loss. As a nutritional therapy practitioner, the weight loss literature that I looked at resonated with what I experienced within my own practice. A number of studies have also recognized the significance of the psychology behind obesity weight loss. And the rationale for me was really to understand specifically here the positive consequences of weight loss by collecting lived experience descriptions using a methodology that would be able to describe, comprehend, and illuminate the meanings of experiences at an individual level. Therefore, I looked at a methodology called Interpretative Phenomenological analysis, which specifically looks at collecting lived experiences, so is able to help me describe, comprehend, and then interpret the meanings that participants give me in their experiences. This methodology also looks at specifically a purposive, reasonably homogeneous sample. So what this means is where participants have had a similar experience of, in this instance, personal growth. This methodology also focuses on ideography, which translates to an analysis of experiences of a small number of participants. In my study, I looked specifically at female participants, here aged between 22 and 55. There were 4 participants in total. Their ethnicity ranged between Caucasian, British Indian, and British Black. They were single or married, and they all experienced weight loss of 15 or 40 kilograms in 1 year or more. So their experiences were similar over these particular times. The methodology specifically focused on subjective experience of weight loss. So it is a qualitative study, and it really looks at the individual's life world, so in their particular instance. And then it requires me as the researcher to interpret what their experiences are, rather than to just describe their experiences. So I really need to extract meaning. So we talk about meaning making. And this is really specific to interpretive phenomenological analysis. And it resonated with the kind of question that I was looking to answer in terms of exploring the phenomenon of personal growth. The methodology is an inductive methodology, so it really requires an immersive and iterative approach to investigate the experiences in depth, and as mentioned before, using an ideographic method of a small sample size to really focus on the particular rather than the universal. So to access the participants' life world, I really needed to explore in depth some of their experiences. I recruited participants through an ethically approved approach, and I interviewed participants using a semi-structured interview where I had an interview guide really just to help me explore participants. It was with open-ended questions, and it was used to really help participants to recall what they had experienced at the time. When looking at the findings, I used the methodology which really attempts to explore and interpret the meaning of the phenomenon through the subjective experiences of the participants. And to this end, the data really helped me to create an evolving process of personal growth, which was constructed out of unfolding the narratives of various themes as which I identified from the participants' experiences. And then I used specific quotes from participants' narratives to support the themes that I was able to interpret. So the three main themes are indicated on this slide. They are the main themes being superordinate themes. The first superordinate theme being physically large, the unknown self. This was quite significant at the outset of the journey for participants who really felt their physical self was linked to their emotional self as a central theme, where, they just felt so physically large and they didn't know themselves in this state. As one participant said at the outset, I think when you're fat, you're just like this all the time, hiding in the fat. And this was just resonated in bringing this quote out, how she really felt consumed by her physical self and trapped in her own body. And this was felt by some of the other participants, so became one of the central themes in the process. The second subordinate theme, evolving from worthlessness to self-awareness, this was identified by most of the participants where they felt they started to see a slight change in their physical self as they lost the weight. They started to identify a changing awareness of the self that enabled them to develop a sense of the self beyond worthlessness. As one participant said, I was just trying to go for walks and small runs, which I never thought I had been able to do before I started the weight loss journey. The third theme of finding the self was highlighted by really the self-awareness of the participant, where one's belief in oneself determines how one feels and thinks and behaves. And so seeing themselves as capable brought into view a cognitive self-awareness, a finding the self. The self is capable was voiced by all four participants towards the end of interviews and expressed in words such as feeling worthy, achieving for the self, and being motivated. As one participant said, she was able to evaluate her ability and feel more capable. She said, the best part of the whole process is that I've managed to get to know myself. So finding the self was really significant. So when considering the narratives of personal growth from the participants' subjective encounters, their journey started with their initial obese bodies and not knowing themselves. And then as they lost weight, their personal growth evolved from being physically unable to become physically able to do the things that they desired to do. This physical ability helped to create a positive relationship with the individual's capability and emotional well-being, which ultimately culminated in feelings of happiness in themselves and their physical bodies. Moving on to the discussion. So the findings of this paper support some of the published qualitative literature on the lived experience of personal growth in obesity weight loss, where for these participants, the three main themes were, as I highlighted, being physically large, the unknown self, moving from worthlessness to self-awareness, to ultimately finding self-awareness. So to support a personalized nutritional therapy approach to assist in identifying specific outcomes in addition to weight loss, understanding the psychological emotions involved in weight loss really is important and corroborates some of the literature on psychological improvements from weight loss, such as being more self-aware, being happy in the physical body, and being able to do more normal things. The study also highlighted that an obese individuals live with a sense of shame, and that weight loss led to self-discovery through an increased physical capacity. Newer aspects identified in the study were that weight loss was an evolving process to uncover the self, where women felt initially inhibited and incapable in their obese bodies. They then became aware of their ability to do more normal things as they lost the weight. So that emotional turmoil that they encountered really started to decrease. So the findings moved beyond just what we already had seen in the literature of improved body image and care of appearance and increased self-confidence and happiness, actually moved through to an individual's physical ability and how that could impact on feeling more capable. So in the current study, weight loss led to a self-discovery through a process of personal growth with positive physical and emotional outcomes, and that these findings emphasize an individual's need to become physically able to find and know the hidden self. And this in itself then allowed access to feeling capable as significant in the process. Moving on to the strengths and limitations of the study, strengths included applying the theoretical principles of interpretive phenomenological analysis, which is a loosely based 6-step analytical process. This process allowed me to really be transparent in my data analysis process so that anyone reading the research could have picked up and done exactly what I did in a step-by-step process. And this analysis of the subjective experience really led to in-depth experiential themes. Limitations included not addressing the negative consequences during weight loss, a reasonably homogeneous sample of participants, even though the various lengths of weight loss existed, being 1 year or longer, and the study excluded male participants. This research suggests a few areas that nutritional therapists could use in a personalized, client-centered approach to focus on fostering a stronger therapeutic relationship. And the clinical implications are one of the main reasons why I undertook this research as a nutritional therapist and why a master's research really has been so significant to enhancing my practice and helping clients to have the most successful weight loss journey possible. So from the study emerged concepts of the hidden self, such as shame and self-criticism. So therefore, understanding how to harness the psychological approaches to understanding clients' level of self is really important. And that a nutritional therapist who is sensitive to these emotions could help to foster an empathetic approach, armed with the knowledge of some of the inherent difficulties of trust and embarrassment that a client might face. So using interpersonal process such as active listening, asking open questions, and keeping an open mind really is important during a consultation process. And understanding this level of self really will impact on a client's level of disclosure, which is really important for a nutritional therapist to understand. And then having an understanding of this sensitivity helps a nutritional therapist to understand and know they need a non-judgmental approach. Another aspect within a clinical implication is to explore specific limiting aspects which might inhibit weight loss. So knowing a client's self-awareness or lack of self-belief might inhibit a journey. These are relevant to know at the outset during a client consultation with obesity weight loss. Alongside negotiating a nutritional therapy program with a client to support weight loss could simultaneously mean helping a client to focus on identifying explicit personal growth goals. And these goals could be tracked in a Measure My Medical Outcome profile, which we use on an ongoing basis in clinical practice. So using the MyMOP, where a client could identify specific personal growth goals beyond just a number on a scale, could be important. So being aware of a physical capacity has alerted me to opportunities to notice and strengthen a client's capacity as it emerges. And hence, this research has really been significant to pushing my practice that one step further and being able to offer a unique offering to my clients. In conclusion, then, a phenomenological view has revealed an awareness of aspects of shame and a lack of self-belief that may exist at the outset of a weight loss journey. And from this insight, a consideration for clinical practice is whereas weight loss is important, other psychological needs may be equally important to address from the outset and be monitored over the course of the weight loss journey. For a nutritional therapist, the understanding of the personal experience of self-awareness and physical capacity has provided me with an opportunity to enhance a personalized approach to weight loss in my clinical practice. This study represents an original study into the phenomenological aspects of personal growth that may exist in a weight loss journey and really has allowed me to explore a whole new aspect of weight loss. This last slide presents the various references that I have alluded to in this presentation, which you may like to go and have a look at after the fact. Thank you so much for listening.